most people who have bone on bone arthritis have no idea that actually what caused the articular cartilage cells to die is they actually drowned to death. And then they're like, what do you mean they actually drowned to death? Well, when you actually walk, what nourishes the articular cartilage is the force of you walking, pushing the joint fluid into the articular cartilage. The articular cartilage is very impermeable to fluid. The speed at which the fluid gets pushed into the articular cartilage is 100 million times slower than the speed of walking. Like, that's how slow substances get into the articular cartilage. What do you think's going to happen if you get a crack in your articular cartilage? Just think about one crack. So now you have a crack in your articular cartilage. What do you think is going to happen? The hydrostatic pressure in the articular cartilage, in other words, the joint fluid through that crack, because doesn't fluid go to the path of least resistance, all of a sudden when you're walking, there's this enormous pressure going through that little crack in the articular cartilage. What's going to happen? Now you have a force on top of the crack. Now you got inside the articular cartilage, you got all this force building. Then all of a sudden there's going to be all kinds of cracks. And then some of the cracks coalesce and that forms a loose body inside the joint. So once the percentage water of the articular cartilage, so articular cartilage normally has about 70% water. So in other words, once the hydrostatic force is so great through all these little cracks that the percentage water inside the articular cartilage gets 80%, 90%, then basically all the cells burst and all the cells basically drown to death. So this is why I'm so against, I can't tell you how much, about one cortisone shot. Because all you have to do is, in animal studies, when they do one cortisone shot and then the animal just is allowed to walk around, they get all kinds of cracks in the articular cartilage. You can't do that, because then all of a sudden you're going to have a crack in an impermeable or very little permeable substance. Then all of a sudden, every time you walk, there's all this force going inside the articular cartilage that ultimately is going to cause gangrene in the articular cartilage. So the treatment should be is, if you have pain in the joint, around the joint, the pain is coming from something beside the articular cartilage. The articular cartilage has no nerve supply, so it can't be causing pain. So just by that, it's not a cartilage problem. Most of the nerve endings are in the ligaments. So that's why I think almost all the pain around the joint occurs in the ligaments. So the treatment should be at causing the ligaments to strengthen and tighten, and the treatment to do that is comprehensive hemohackett prolotherapy. So that absolutely should be the treatment of choice when a person starts getting joint pain.